What is macular degeneration? All you need to know about macular degeneration is going to be available for you in this video. So take a look at this video till the very end. This is Dr. Anina Abraham. I'm a retina specialist in Hyderabad from Advanced Retina Care. Macular degeneration is first of all degeneration of the macula, which is the central portion of the retina. Take a look at this video to understand what macular degeneration is. The macula is the central portion of the retina. The retina is the light-sensitive layer at the back of the eye. When the normal macula undergoes degenerative changes, we call it macular degeneration. What are the types of macular degeneration? Let's take a look at this video to understand what the two types are. You have a dry macular degeneration and a wet macular degeneration. Take a look at this. In dry macular degeneration, there are yellowish deposits called drusen under the center of the retina. Eventually, this leads to RPE degeneration. The center of the retina gradually undergoes atrophic changes. In wet macular degeneration, there is collection of fluid or blood under the center of the retina. This causes sudden loss of central vision. What are the differences between dry and wet macular degeneration? Dry macular degeneration commonly happens in both eyes simultaneously. And it's a very gradual onset. So many patients don't even know they are developing a macular degeneration. It's when they go to the doctor that they understand that there is some problem with the macula and they need an OCT scan, they need fundus pictures, they need a fundus fluorescent angiography to understand the stage of the disease. So dry macular degeneration happens in both eyes and is gradual in onset. Wet macular degeneration happens suddenly. And this commonly happens in one eye first. So if you have suddenly developed the following symptoms, you may be having a wet macular degeneration. What are the symptoms? Suddenly your straight lines appear wavy. You can be having a black spot in your vision, something called metamorphopsia or distortion of vision. Sometimes you can see letters smaller or bigger than they actually are. And all this happens in one eye. So you compare one eye with the other and you see there is suddenly difficulty with reading, especially reading those letters in that book. That's when you understand that, yes, probably I have wet macular degeneration. So the difference is, again, this is sudden in onset and dry macular degeneration is gradual in onset. Wet macular degeneration can be treated. You can give injections for wet macular degeneration and completely cure the bleed, completely cure the fluid inside the retina. But again, how much vision can improve after this? There will be some amount of vision improvement, but let us understand it can never become like a normal eye. The reason is there is a lesion there under the center of the retina, and that lesion has to scar. How does it heal? By scarring. So if there's a scar on your retina, you cannot be having the same vision as a normal, healthy retina. Let us take a quick look at this video to understand the symptoms of macular degeneration. For macular degeneration? Yes, there is a cure. If you have wet macular degeneration, there is a cure. Again, you should not reach the doctor late. There are patients who say, I will go after 6 months and see the doctor. By then, it would have become a very, very big scar on the macula. The idea of treating a wet macular degeneration is to make the scar as small as possible. So your black spot will not be very, very large in your vision. It will be a tiny black spot in your vision. It is possible that vision also improves with time. That is, if you are treated. So is there a cure? Yes, there is a cure, but you need to be treated on time. Again, what can be done for wet macular degeneration? Intravitreal injections are available. These are called anti-VEGF injections, and these injections may sometimes be required 3 times, sometimes 6 times or more. It depends upon the size of your lesion. Now, the problem is when you get injected very late. If already a part of it has got scarred, you cannot expect too much of visual improvement. However, if you go in time for treatment, the area of the lesion can be treated very, very fast. And this results in scarring in a very, very small area of the retina. So I recommend early treatment for cases of wet macular degeneration. Is there a permanent cure for macular degeneration? Unfortunately, there isn't any permanent cure. The reason is because at any time in life, there can be a recurrence of the same problem. Now, what has happened is you have been treated, your scar has formed on the retina. Adjacent to that scar, another active lesion can develop, and this can happen any time in life. There's really no prevention for it, and there is no way you can stop a recurrence. The only thing you can do is get treated when there is a recurrence, accept it and get treated. If you don't take the treatment, you will end up with massive scarring in the retina. Is there a chance of becoming blind due to macular degeneration? No. Please understand that macular degeneration involves only the center of the retina. What you can lose is central vision. There is a component of peripheral vision as well. Peripheral vision cannot go with macular degeneration, so you will be able to go about doing your duties. The only reason you have possibly lost peripheral vision is because glaucoma has existed along with macular degeneration. We have seen so many cases like that. Doctors have not diagnosed glaucoma in cases of macular degeneration. The reason is that stands out. Macular degeneration stands out, and they forget to look at the optic disc. Always rule out glaucoma in cases of macular degeneration. The reason is macular degeneration will affect the central vision, glaucoma will affect the peripheral vision. It is very important to save peripheral vision in cases of macular degeneration because we do not know to what extent that scar is going to form. We want the best possible vision for you. Can you have cataract and macular degeneration? Yes, you can definitely have cataract and macular degeneration and glaucoma. You can have 3 conditions existing in the same eye. What do you do about it? Number 1, get the cataract operated. The reason is because cataract causes a diminishing of vision. Your vision becomes very dull. It becomes very cloudy. Let us first get rid of that. Doing your cataract surgery is not going to worsen your glaucoma or your macular degeneration. In fact, it will get the maximum possible vision back for you. Once you treat the cataract, let your doctor take a look at your macular degeneration and tell you if you need any further injections. And glaucoma has to be treated on the side with eye drops. So many drops are available to control the intraocular pressure. If it is not getting controlled, even surgery is available for glaucoma.